We're going to go in a certain order. I'll start out. I'm Congressman Jerry Nadler. And let me say that this cruel bill is the ultimate betrayal of the people of New York. We already knew Trump's dangerous bill takes from the poor to give to the wealthy. But new analysis shows it would slash incomes for the bottom 60% of American earners within a decade. This bill is a direct attack on America's working families. It would strip health care from more than 1.5 million New Yorkers, cutting them off from the doctors they trust. Nationally, experts estimate these cuts could lead to over 51,000 preventable deaths each year. Here in New York, 70 hospitals are at risk of closure, including 22 in Republican districts. 7 are in Representative Stefanik's district, and 5 are in Representative Lawler's district, for example. If these hospitals shut down, people in those districts and surrounding districts will die. The bill also guts SNAP, threatening food assistance for over 300,000 New York households, families with children, seniors, and disabled New Yorkers. The average household will lose $220 a month in grocery support. And Republicans voting for this bill are hurting their own districts. Representative Stefanik, for example, has nearly 89,000 SNAP recipients in her district, and Representative Lawler has nearly 67,000. How do they look these families in the eye? Even the few provisions in this bill that claim to help working people, such as lifting the SALT cap or eliminating taxes on tips and overtime, expire in just a few years, while tax cuts for billionaires remain permanent. In fact, if Republicans simply do nothing, the SALT cap will expire in December, and New Yorkers would be better off than they are under this bill. This bill doesn't just abandon our constituents. It punishes them for getting sick, for struggling to feed their families, for needing support in a moment of hardship. And while Alaska and 9 other states secured a carve-out to shield their hospitals from the worst of these cuts, New York Republicans are voting for a bill that leaves their own state fully exposed. No exemptions, no protections, just devastating consequences for our hospitals and the people who rely on them. I urge my Republican colleagues from New York to think of their constituents, think of their state, and reject this cruel and reckless legislation. Thank you, and I yield to Congressman Greg Meeks.
Thank you, Jerry. First, let me thank Leader Jeffries, who has been strongly supporting and leading not only this delegation, but the entire Democratic caucus in its effort to make sure that we are standing strong against this terrible, ugly bill. Leader Jeffries has been outstanding, and every Democrat is united. But we're here today as New Yorkers because this bill really hurts everyday, hardworking New Yorkers. So let's be clear about this. The Trump administration and Republicans, they will be handing out these huge tax breaks to their billionaire donors. Working families in New York, what are they left with? Holding the bag. That's what New Yorkers, hard workers, will be left with. This bill will rip health care away from 17 million Americans, slashing Medicaid, Medicare, and Affordable Care Act by over $1 trillion. The bill that the Senate sent back to the House is worse, if you could believe it, than the bill that the House sent to the Senate. The bill that we will be voting on today is the biggest health care cut in American history. More than 1 million New Yorkers will lose their health insurance under this plan. New York alone, 1 million New Yorkers. In my district alone, for example, over 300,000 people rely on Medicaid for their health care. And this bill will gut Medicaid and the Affordable Care Act, leaving our most vulnerable neighbors at risk. For residents who get coverage through the ACA, premiums will spike by an average of $2,030 a year. And that's a 44% increase, hitting families who can least afford it. To pay for tax cuts for the ultra wealthy, what are the Republicans doing? They're gutting SNAP, pushing millions into hunger and forcing children to go to bed without food. And it gets worse. According to the Greater New York Hospital Association and the Hospital Association of New York State, this bill will cost, for example, my district, over 1,000 jobs and around 500 hospital workers, and result in over $237 million lost in economic activity in our local communities, in my local community, and just imagine what it does across the state. That's 65,000 jobs lost in healthcare sector alone across New York State. That's roughly 86,000 people here in New York, in my district alone, that SNAP puts food on the table for. And this bill would force states like New York, which helps cover the administrative cost for SNAP, to either cut benefits, restrict eligibility, or abandon the program altogether. That means our local food banks will be overwhelmed. Our kids will go hungry, and our seniors will be left behind. And one last thing, because it doesn't just stop there. Pell Grants for nearly 270,000 New York students are on the chopping block, slashed or eliminated entirely. It slashes support, makes student loans more expensive, eliminates key hardship protections, and limits how long students can keep their loans in deferment, just as the cost of living and tuition continues to rise. If ever there was a bill that is a reverse Robin Hood situation, taken from the poor, taken from the middle class, to give to the ultra-rich, that is just this. So let me just say, over $5 trillion tax giveaways for the wealthy. And the bottom gets nothing. That isn't America first. It's America for sale, and working people are getting sold out. This big, ugly bill is a direct attack on working class communities like mine, and we've opposed it from day one, and we're not going to back down. We will keep fighting to make sure that this president and congressional Republicans don't keep getting away with ripping off the American people and following this con game that the president is continuing to move on everyday working Americans. And with that, I'd like to bring up Representative Joe Morelli from Rochester, New York.
Thank you to my dear friend Greg Meeks. Thank you to Leader Jeffries for the amazing job he's doing. I know all of us here as New Yorkers are so proud of the work that he's doing, and thanks to all my colleagues and friends for being here. This is, as the Dean of our delegation, Mr. Nadler and Mr. Meeks have both said, deeply frustrating, painful, and frankly a baffling moment for our country. Like many of my colleagues here, I had the privilege of serving in the New York State Legislature and was blessed to serve as the Majority Leader of the New York State Assembly before coming to Congress. For the people of New York, this is a betrayal. And when I hear Representatives, in particular Lawler and Stefanik, discuss their potential plans to run for governor of New York, I get about as angry as you can get, because they are talking about voting yes on this bill. From every indication, they will vote yes on this bill. And frankly, they don't deserve to represent the state of New York. They know this bill is only good for Donald Trump and his billionaire friends, not for the people who live in the Empire State. No one truly wants this bill to pass. Even when we talk to Republicans behind closed doors, they're asking the same question we are. What's the point of this bill? Because here's the reality for New York. It takes $4.4 billion from New York's healthcare system. It kicks 1.5 million New Yorkers off their health insurance. It raises health premiums by nearly $2,000 for some people. and it forces New York counties to pay $266 million more to keep families from going hungry. That's not budgeting. That's cruelty. And these aren't just numbers. They're neighbors, they're children, they're veterans, they're working families trying to get by every single day. And all of this while exploding the national debt by over $3.3 trillion. So again, I ask, what's this for? I think we all saw who was sitting beside Donald Trump on Inauguration Day, his billionaire donors and corporate backers. This bill is not about balancing the budget, God knows, or helping Americans. It's about giving those same billionaires handouts they certainly don't need on the backs of working New Yorkers. My colleagues across the aisle have one final chance to do the right thing. If you vote for this bill, you, Representatives Lawler and Stefanik, will be personally responsible for taking health care from 1.5 million New Yorkers. You will be personally responsible for putting nearly 3 million New Yorkers at the risk of losing food assistance they depend on to survive. And you'll be doing it while giving special status to Alaskans and Hawaiians over people of New York. You'll give them privileges you won't even vote for your own constituents. And you will not be able to hide from these consequences. Not here in Washington, certainly not back home in New York, and not on the campaign trail. New Yorkers are watching. We will remember, and we will watch you vote, and we will vote when it comes time next November. We're going to keep fighting for workers, for families, for veterans, not for Trump's gaggle of billionaires. This isn't over by a long shot. With that, let me now ask my dear friend, the ranking member of the Standing Committee on Small Business, the distinguished representative from New York, Nydia Velasquez.
Thank you. Thank you, Joe, and thank you, Greg and Jerry Nadler, and I want to thank Leader Jeffrey for bringing the entire caucus together to denounce this senseless package. What we are witnessing in the House today can only be called a betrayal of New Yorkers and the American people, plain and simple. This process has been incredibly rushed to meet a fake deadline by the president. Our colleagues on the other side want to pass this without even understanding what is really in it. Meanwhile, everyone knows the disastrous impact this will have on working families. This bill will make New Yorkers sicker, hungrier, and poorer. Also, Republicans and Donald Trump can hand out permanent tax breaks to billionaires. It will take health care away from 1.5 million New Yorkers. They want to destroy Medicare and the Essential Plan, programs that keep hospitals running and ensure low-income families, seniors, and new moms can get care. In New York alone, we're looking at $8 billion in cut to our health care system, 65,000 jobs lost, and hospitals being forced to shut down services or close altogether. This bill will hit every corner of New York, from New York City to upstate. The effects will be devastating. Republicans have also wanted to gut SNAP, a program nearly 3 million New Yorkers rely on to feed their families, many of them children. We're talking about children, seniors, and veterans who depend on this type of support to survive. Experts estimate that this bill could lead to more than 50,000 preventable deaths every year. 50,000 lives lost, all for a tax cut, is disgraceful, is shameful, and is cruel. Why would anyone vote for this? Why would Mike Lawler, Nick LaLora, or any of the so-called moderate Republicans allow this bill to pass? For months, Lawler repeatedly promised his constituents that he wouldn't support any legislation that included Medicaid cuts. Now he's about to sell them out by voting for this bill. In the process, he could take health care away from 32,000 of his own constituents, strip 18,000 households of their food assistance and put 8 hospitals in his own district at risk of closure. So, again, why on earth would Mr. Lawler, he's been discussing running for governor, how could he vote for this bill? Because he only cares about one thing and one thing only, the approval of Donald Trump. And our Republican colleagues are on the verge of selling out New Yorkers all across our state in order to get that approval. The American people will not forget this. New Yorkers will not forget this. And I'm sure that some of us will help constituents in those moderate Republican districts remember this. Thank you. Oh, yes. Next, my great friend from upstate, George Latimer.
Thank you very much, Representative Velasquez. Westchester County is upstate, if you're in Brooklyn, and we are part of New York City if you're from Buffalo, so that gives us a special consideration. We need a serious reality check. We're looking at what proposes to be a budget, but it's really an ideological statement, and it's not a document that you can govern and work with people on. I'm only 6 months here in this chamber. My colleagues, almost all of them, have much more experience than I do here. But for 7 years, I ran Westchester County government. It's one of the largest governments in the state as a large county. And when you govern, you have the responsibility for an end result, not just for rhetoric, not just for words that might capture you votes or polling data. What's in this budget is going to make it impossible for mayors, supervisors, county executives, and if you want to look nationwide, governors of states, to govern, to actually deliver the services that people want. When we talk about the health care impacts of this, and my colleagues have spoken about it already, my friend Adriano Espiat is going to talk a little bit more about a topic I'm touching on, the federally qualified health centers. You're looking at a real world where if we don't have health care ability for people to afford it, what do? Do they lie in the streets? Do we have to house them as homeless and unable to help them solve their problems? Do they show up at the emergency room of a hospital, and does the hospital stay there? Parts of this state, Paul Tonko will talk about it. In the northern part of New York State, you have one hospital in Glen Falls, nothing nearby, and you have a federally qualified health center not far from that in Warrensburg. That's all you have. And when they talk about, well, we have to have work requirements for people taking Medicare, they're not actually on the firing lines looking at who goes into these places. In my home county, Open Door provides different locations for health assistance for those people that are indigent. 18 service sites. Some of them are in the 16th district that I represent. Some of them are in the 17th district directly north of me. I was county executive for that whole area, so I don't look at the dotted lines of a district. If something's happening in the Bronx, it's me and Richie and Adriano and Alexander that care about it, not the dotted lines that divide us. We have Open Door has 18 service sites, 60,000 total patients. 46% of them receive Medicaid benefits, and 38% of them are uninsured. This plan will reduce that ability for Medicaid to help that portion of people, will hurt some on Medicare, and will have an impact on those other in the Affordable Care Act. What do we do with those people when they need the services, management for diabetes, asthma, hypertension, immunization? It's a real-world problem on the streets, real-world problem in the subways of New York City and on the buses of Buffalo and Rochester and Albany and in Westchester County. Sun River Health Systems. It's based in Peekskill, that's in the 17th district, but it has a major operation in New Rochelle in the 16th district. Nobody thinks in terms of districts, they think in terms of services for human beings. And they don't look at this human being and try to assess what is their demographic. Are they this ethnicity or that ethnicity? They're poor, and many times working poor. People who work as janitors, they work in restaurants, they make money, and they work hard. They do jobs that other people wouldn't do. But they don't make enough in those jobs to be able to pay for the services or the medical benefits they need. Sometimes it's prescription drugs. They don't have the money for it. That's what Medicaid does. 17,000 patients in my district in Sun River, and that's the smaller portion of what Sun River does. Westchester Community Health Center, which has multiple locations across our county. And this is replicated everywhere around the state. We are all people of faith, and we have different faiths here. In my faith, there's an oft-quoted portion of Matthew 25, and it says, Lord, when did I see you hungry and gave you food to eat? When you had money for SNAP, so the Meals on Wheels program could bring food to your door. When did I see you sick and I ministered to your needs? When you had a hospital or nursing home or a federally qualified health center that could provide you that health? When did I turn my back on you, Lord? When you did it for the least of my brothers. That's what this is about. This is helping those in this society that need that help because we believe in compassion. And we believe in delivering that compassion through the tools of government. One of my colleagues has run a government. She's been town supervisor of her hometown on Long Island. And she has shown her leadership and now brought that leadership here to Washington. Congresswoman Laura Gillen of Long Island.
Well, I thank the leader for his leadership on fighting against this bad bill. I thank our New York delegation for standing together, united against this bill. You know, I was a little bit late for this press conference, and I'm going a little bit off script here. But on my way back to my office, I was stopped by a group called Little Lobbyists, and it was parents with special needs children. And they are begging. They are going around the House offices begging people to not take their Medicaid away from them. I heard from a mother whose daughter was in a wheelchair. She went into bankruptcy and she sold her house because when you have a child who has a brain tumor and brain cancer and a genetic disorder, I don't care what party you are, I don't care what race you are, I don't care what religion you are. If you are a parent, you will do anything you can to save your child. And only after her family went through all of that loss did they qualify for Medicaid. Medicaid is keeping her daughter alive. And she had tears coming down from her eyes, saying, please, I don't know how my family, we're just getting back on our feet again. I don't know how we'll take care of our daughter if Medicaid is taken from us. And then there was a mother with a child with a genetic disorder, and she said that because of Medicaid, she can stay home and take care of her child. He requires constant care. Guess what? She's not staying home because she's lazy, because she's a fraudster, because she's trying to cheat the system. She's staying home because she wants to give the loving care to her child. And guess what? That saves taxpayers a lot of money for her to care for her child at home. But with the cuts in Medicaid, she will probably have to send her precious child to an institution, to a nursing home, if there are any nursing homes left after these devastating cuts. This bill is cruel, but it's also bad for New York for other reasons. Now I'm going back to my points. Since taking office, my top priority has been trying to get the SALT deduction cap eliminated. It wreaks havoc on the monthly budgets of families across high-tax states like New York. And last year, my Republican colleagues in the New York delegation promised that they would hold the line for a full repeal of the cap. In January this year, they changed it a little bit, and they were discussing a $100,000 cap instead. And now they're settling for a fraction of that. And it doesn't have to be this way. As I think Representative Nadler said, if we do nothing, the SALT cap will just expire at the end of the year. They could just do nothing and bring relief to their constituents. But the Senate bill is a sellout for Long Island. It's a sellout for New York. And families across the region who are hoping for meaningful tax relief will still be forced to pay double taxation going forward. And that's not all. After 5 years, this short-term fix will revert right back to the $10,000 cap that they said was outrageous and they would never support it. It goes right back to that. Just 5 days ago, my Long Island colleague on the other side of the aisle, Rep. Nick LaLota, said he would need a forever fix to vote yes. Well, we'll see what happens maybe in a couple of hours. This morning, he already did a vote to advance this half measure. Long Island families and families across New York are hurting from the cost of living crisis that we face, and they deserve better than this political football. Republicans are also pushing costs on a cash-strapped, overburdened counties and hospitals, putting another tax burden on our constituents. The New York State Association of Counties is warning that $266 million in new administrative costs will be pushed to each of the counties across New York State. And New Yorkers pay already some of the highest tax burdens anywhere, and we send way more to Washington than we get back. But the Republicans think it's better to make us pay even more in taxes to subsidize red states and to pay for our health care. Our constituents sent us here to fight for them, to protect their health care, to make their life more affordable, and to make their lives better. This bill does the exact opposite. And now with that, I will turn the mic over to my esteemed colleague from Manhattan, Dan Goldman.
And Brooklyn. Thank you to Congresswoman Gillen. Thank you to Congressman Meeks, Congressman Nadler, and of course Leader Jeffries for leading our delegation and our party. There are lots of different places we can go with this bill because it's so bad in so many different ways. But I want to emphasize one thing, and it's really the primary reason why we are here today. There are 7 Republican members of the House of Representatives from New York State. The Republicans have a 4-person majority. If any 4 of the Republicans from New York State were actually to stand up for their constituents, they could kill this bill and get a much better deal for their constituents. So that members like Nicole Maliotakis would not be voting to kick 37,000 of her own constituents off of health care. This, after she had said on April 14th, and I quote, "I cannot and will not support a final reconciliation bill that includes any reduction in Medicaid coverage for vulnerable populations." Well, I don't know what a $1 trillion cut in Medicaid is, other than a reduction in Medicaid coverage for vulnerable populations. And it doesn't end there, of course, because we have the SNAP cuts. Literally, the most vulnerable people in our society who get $6 a day just to eat are going to have to worry about whether they have food on the table. I'm just going to focus on 2 other issues that haven't been touched on yet because I think they're very important. The first is the rollbacks on the Inflation Reduction clean energy subsidies. New York is a leading state in clean energy, in solar, in wind, and it is new energy sources made in America by Americans that are good for the environment, but also will satisfy the increasing demand we have for energy for AI and other quantum physics and other scientific advances. But notwithstanding the fact that we are a leading state in that, this bill rolls back significant portions of those clean energy subsidies. Why? Well, you may remember the reporting on the campaign trail when Donald Trump met with oil executives. And he said to them reportedly, "If you all give me $1 billion, I will take care of you." Well, they gave about $500 million, that's public. We don't know how much in dark money over the last cycle. And here, Donald Trump is taking care of them. And he's taking care of them not only to the detriment of American jobs, to the detriment of American manufacturing, to the detriment of our national security and energy independence. He's taking care of the oil executives over his own voters because the vast majority of money from those subsidies has gone to Republican states and Republican districts. That sums up this bill in a nutshell. Donald Trump is selling out the American people
for oil executives and billionaire donors. And the last thing I'll just touch on is that notwithstanding all of these cuts to critical programs, this budget increases ICE's budget by more than 3 times. And just as people are losing jobs, are losing health care, are losing food benefits, it's good to be a masked ICE agent, because every single one of them will get a $40,000 bonus in this bill. This is cruel, it is unusual, it is inhumane, but most of all, it is un-American. And if 4 Republicans in New York alone would stand up and say no because of the devastation and havoc it is going to wreak on the state of New York, this bill will not pass. The people holding out, though, are not any of the New York Republicans right now. So I urge all of the New York media to go ask Elise Stefanik, why are you gutting the budget of New York State when you want to lead it? Mike Lawler, why are you taking so many of your own constituents and New Yorkers off of health care, taking basic safety net benefits away from them? Ask every single one of them why they are voting against their campaign promises and against their constituents. Now I'm going to turn it over to my good friend, the junior member from Syracuse, John Mannion.
Thank you, Congressman. I'm going to tell a couple quick stories about what the hospital and healthcare dynamic is like in upstate New York. We have fantastic hospitals. In my district, we have some fairly large ones. Wynn Hospital in Utica. In Syracuse, we have St. Joseph's, Krause, and Upstate Medical Center. And we're really blessed with a very robust system. But in my time in the state legislature over the past 4 years, what I've heard is that these systems are severely strained and difficult decisions have already had to have been made. We also have great smaller hospitals in and out of my district, in Oswego, in Auburn, Watertown, Rome. But when someone has a critical condition that requires intensive care and intensive follow-up care, those smaller rural hospitals, the patients there, they come to Syracuse. I'm going to tell a little bit about Upstate Medical Center. It is our safety net hospital, which means that it is serving our Medicaid patients, and it's also serving those that are uninsured. It is the burn hospital for burn victims over the course of almost every county in upstate New York, and for poison victims, all counties north of my other upstate county with Mr. Latimer, Westchester. That's where those patients go. So when you cut Medicaid funding, you're not just hurting the people of NY22 because our safety net hospital is hurting. It's because when you have a stroke in Minetto, New York, you may go to your local smaller hospital, but that critical care that's needed almost immediately following happens in Syracuse, New York. If someone is a burn victim in Thendera, New York, in NY21, in Elise Stefanik's district, or like I mentioned, in Minetto, in Claudia Tenney's district, those patients come to my district and receive world-class intensive care that is thorough. How do I know this? Because I talk with my larger hospital administrators and workers, and I talk with our medium and smaller hospitals, their leadership and their workers. So it is not about the lines, like Congressman Latimer said. It is about service to the people. So in the Senate, they can throw $50 billion at rural hospitals. Those constituents that live in rural areas, they're coming to urban hospitals in my district. I thank all of my colleagues up here from New York. We represent very different areas. I would like to introduce my colleague from down the thruway, Tim Kennedy. Excelsior.
Thank you, Congressman Mannion. First, let me say what an honor it is to stand with my colleagues from across this great state of New York. I want to thank Congressman Meeks, Congressman Nadler, and of course Leader Jeffries for bringing us all together here today. And particularly Leader Jeffries, not just for leading this delegation, but also for leading our caucus in fighting back against this big, ugly bill. And there are so many reasons why this bill is as ugly as it is, and the worst budget bill in American history. Gutting health care from working families across this country. Cutting Medicaid by hundreds of billions of dollars. Medicare by hundreds of billions of dollars. Cutting nutritional assistance that our children and seniors and veterans all depend upon to feed themselves. And cutting 17 million Americans off of health insurance that they're currently on, including 1.5 million New Yorkers. That's the epitome of cruelty. And in the process, you have to ask why. Why are they doing all of this? To give billionaires a tax break? This is the largest redistribution of wealth in American history. The poorest New Yorkers and the poorest Americans are going to get poorer, and the richest New Yorkers, the billionaire class and the richest billionaire class in America are going to get richer. That is un-American. That is wrong and unacceptable. That's why we are pushing back against this big, ugly bill. And you break it down and what that means for working families across New York and across America. Aside from the 1.5 million people who are going to have their health insurance pulled out from underneath them, it's going to put a strain on our hospitals, in our nursing homes, in our community health centers. Those emergency rooms, we're going to go back to the bad old days with the long lines and the 12-hour waits. And in the meantime, those who are able to afford private insurance are going to see their premiums go up, their deductibles skyrocket, and their copays get more expensive. All again to give a tax break to the billionaires and the ultra-wealthy in this country. It is wrong and it is immoral. There are so many reasons to vote against this bill. Every single New York representative ought to be voting against this bill, including and especially our Republican colleagues whose rural hospitals and community health centers will feel the strain more so than anywhere else, where they're saying they're helping Americans. They're perpetrating a fraud right before the American people's eyes. When they say no tax on tips, well, that's going to expire. No tax on overtime, a half-baked measure, that's going to expire. The SALT deduction, a half-baked victory that they claim, that's going to expire. You know what's not going to expire? A tax break for billionaires and the ultra-wealthy. Another reason to vote no on the big, ugly bill, and another reason why the Republican members of the House delegation in New York, but every member across this country, ought to grow a spine, stop bowing down to their king, Donald Trump, and vote no against this terrible, big, ugly bill. With that, I will call up another great colleague from upstate New York, Paul Tonko, officially upstate New York.
There you go. Well, thank you, Jerry Nadler. Thank you, Greg Meeks, for bringing us together. And thank you to Hakeem Jeffries for his leadership, not only within the New York delegation, but the entire Democratic caucus. So why this press conference, and why now? The individuals behind me, myself, have individually and collectively been speaking forcefully about the pain and consequence of this budget for the last several days, weeks, months. We see what happens to states like New York. We see what happens to every state in the Union. We know that this betrayal plan is exactly that. Vote for me and I'll reduce your costs for groceries, for utilities, for health care, for housing, and the list goes on. What has happened since the beginning of the year? Costs have gone up. And with this bill, they will go up exponentially. Unacceptable, cruel, un-American. That's why we're here. We share a lot of anecdotal stories that have been shared with us. We've heard the heart-wrenching stories. We've shed tears with constituents. This is an emotional impact. It wipes away a lot of history, a lot of fight, a lot of struggle for very good programs. And it doesn't fall gently on the other side. They have deaf ears to all of this history, all of this pain, and all of this consequence. So we need to do better than this. And as has been indicated, if we can get those Republicans in the Democratic caucus from New York, in the Republicans in the delegation of New York, if we can get them to vote against this cruel bill, we can be the state that saves America from all this hardship and pain and suffering. It's real. When we see the consequences of $1.5 trillion taken out of Medicaid and Medicare, it can't help but impact the entire healthcare system. We understand that it goes far and wide. People will say to me, well, I'm not on Medicaid. Oh, but your hospitals are. Your hospitals are. And so when you put the mix of Medicare and Medicaid dollars into the formula, they are all going to be suffering greatly from these cuts. Many of the states, their only dollars for mental health, behavioral health, are federally based. In our state, they're a great bit of resource that we require. We have seen improvements in that addiction curve. It dropped for the first time in a while. What is going to be the consequence there? Because those dollars from Medicaid, in many cases, are the only mental health, behavioral health dollars in the country for many states. We're going to see consequential damage done to the fabric and quality of life. We also see that when you destroy the SNAP programs, you're destroying a part of the wellness prevention program of health care. Youngsters growing and developing in sound fashion. Veterans being assisted to, perhaps from scars from war, seen and unseen. Seniors impacted, perhaps recuperating from surgery, or diabetics that need a sound nutrition program. The list goes on and on. But if this budget, any budget, is supposed to be an expression of values, then we have failed the American public. This is not an expression of American values. This is third world country related. There's no care, no concern, no compassion. And so we need to do better. And what really troubles me, and we've all seen this in the news for the last couple of weeks, it's an immoral bill. It's an ineffective bill. It's an unfair bill. It's a hurtful bill. But I think I'm going to vote for it. What are you telling us? That loyalty to President Trump is more important than doing what's right for your constituents and what's right for America? People need to answer to that. They need to answer to that. And as my friend Dan Goldman indicated, the destruction here of clean energy economy, which has produced significant jobs, are all going to be hurt and impacted by the rollback of these funds. Our environmental stewardship to build a better planet for the next generations is at risk. Our ability to grow the capacity needs for electricity in our country will be made more difficult. So we need to go forward with a sensible, credible, kind, and loving budget bill, not this monstrosity that will really destroy the country and the nation's fabric, and the families and individuals that are so proud of being American. They deserve our respect and our action here that will destroy this document. Now, let me introduce a great friend who also served in the state assembly like I did, who is a leader in the National Party, who's a leader here in the state of New York in our delegation, and also the chair of the Asian American Pacific Islander Caucus, Grace Meng. Thank you for your leadership.
Thank you so much, Paul. Hi, everyone. I'm Congresswoman Grace Meng from Queens and proud to join my fellow colleagues from all across the state of New York as we sound the alarm on this Republican bad billionaire bill. For weeks, we have all been warning New Yorkers about the devastating impact cuts to Medicaid will have on our communities and our entire healthcare system. As it stands, this big, ugly bill will cut Medicaid by $1 trillion, the largest cut to health care in the history of the United States. Across the state, 1.5 million New Yorkers are at risk of losing their health care coverage. Many of them are seniors who live in nursing homes and long-term care facilities. They rely on Medicaid to pay for the care that they receive each and every day to live their golden years as healthily and comfortably as possible. At the same time, many of these facilities are relying on Medicaid to keep their doors open and provide the level of care each patient needs. Across our country, 60% of patients in our nursing homes rely on Medicaid. Their families simply cannot afford to pay for this level of care out of pocket. You can ask them. Ask those who manage the facilities. Ask those who are residents of the facilities. Ask those who work in the facilities and volunteer in them what this bill will do to our nursing homes. We have heard from at least 6 nursing homes who are at grave risk of closure if this bill becomes law. Keeping these nursing homes open is literally a matter of life and death for thousands of seniors in Queens alone. It is unconscionable that my Republican colleagues are willing to put our grandparents and our loved ones' lives at risk to pay for tax cuts that only benefit billionaires. Beyond this, $8 billion in cuts to our hospitals will lead to tens of thousands of lost hospital jobs. Community health centers, as you've heard, will lose an estimated $300 million, which could result in 2,000 layoffs. This will be absolutely devastating for our healthcare system. This bill is a horrible bill. It is un-American. This is the most un-American gift that this president and our Republicans can give to American families, to our seniors and our children right before the 4th of July holiday. Please ask our members. You've heard from Dan. There are 7 just in New York alone. They don't even have to all vote against it. We just need 4 of them to do the right thing to help our American families. Next, I want to invite the chair of the Congressional Hispanic Caucus, Adriano Espaillat.
Thank you, Grace. Thank you for your leadership, and thank you to Leader Jeffries and, of course, Jerry and Gregory Meeks for putting this together. This bill cuts Medicaid and the Affordable Care Act for more than 17 million Americans that will be losing health insurance throughout 2034. This will be devastating to New York's 13th congressional district, which I represent, as 488,000 of my constituents, close to 500,000 of them, are Medicaid recipients, and they will be severely hurt. Specifically, I want to go to the numbers that will impact the hospitals and, of course, the community-based health centers that have been spoken about. There are 10 federally funded health centers in New York's 13th district that serve up to 1 million patients a year. That will devastate those centers. Montefiore Hospital which is right in the outskirts of my district and shared by Congressman Richard Torres, 80% of their patient population uses some form of government assistance, including Medicaid and Medicare. They will be crushed. Presbyterian Hospital, 64% of all people admitted and 62% of all outpatients receive Medicare and Medicaid. Now, Presbyterian is in northern Manhattan, but they have a Westchester operation, two of which are in Representative Lawler's district. Harlem Hospital, 85% of all people admitted and 71% of all outpatients receive Medicaid or Medicare. Mount Sinai in East Harlem, 67% of all people admitted and 64% of outpatients receive Medicaid or Medicare. Federally qualified health centers and safety net hospitals play a unique role in our communities, and they must be preserved. They must be saved. They bring services to the most vulnerable in our community, and this bill will cripple them. So we must do everything we can to preserve them, and there are seven Republican members in our delegation that have the ability to do this. Four of them, just four of them, will have the ability to do this. In the neighborhood that I grew up in Washington Heights, if the bully came to the neighborhood and talked down to you and pushed you around and called you names, and you stood up to that bully, you became a hero. People liked you. Grandmothers fixed you dinners. Little kids will follow you around. Heck, you may even get a vote or two. If you were that person that stood up to the bully, you were a hero. If you didn't stand up to the bully and you sided with him, people consider that punking out. You punked out. So Lawler, you punked out. Stefanik, you're punking out. Malliotakis, you're punking out. Lelota, you're punking out. Help me out here. Barbarino, you're punking out. Steny, you're punking out. Who else did I miss? Langworthy, you're definitely punking out. And Teddy, you're punking out. I said Teddy. Now, if some of them need a change in direction, I will invite them to come to New York Presbyterian's Spine Institute, and they could get a new spine because they're punking out. Thank you. I would like to introduce my colleague from the Bronx, who shares Montefiore Hospital with me, Representative Richie Torres.
As a wise person once said, everything that can be said has been said, but not everyone has said it. But it's an honor to be here with my colleagues in defense of New York, in defense of America, against the worst piece of legislation in the recent history of our country. The Republican reconciliation bill is as fraudulent as the populism of Donald Trump. Donald Trump is betraying the very working people that he pretends to champion. The so-called Big Beautiful Bill would cause 17 million people to lose access to health care. It would slash Medicaid and children's health care by $1 trillion, the largest health care cut in history. It would slash SNAP by $300 billion, the largest food assistance cut in history. It would raise the cost of electricity for families by an average of 7% and for businesses by an average of 10%, with increases as high as 33% in the hardest hit states. And it would add trillions of dollars to the debt, putting our country at risk of a debt spiral. Right? The so-called Big Beautiful Bill is not only a redistribution of wealth from the rich, from the poor to the rich, but it's also a redistribution of wealth from America to foreign bondholders. Instead of paying $1 trillion a year in debt, we're going to pay $2 trillion a year in debt, which is money not spent on health care and housing and higher education. And so I have a simple question for the so-called moderate Republicans in the New York delegation. Where do your loyalties lie? Do your loyalties lie with America or with Donald Trump? Does it lie with New York or with Donald Trump? Does it lie with working people or Donald Trump? And the so-called moderates in New York and elsewhere have consistently chosen Donald Trump over the American people and the people of New York. You know, when America sneezes, the Bronx gets the flu. The Bronx is going to be the hardest hit by the $1 trillion cut to Medicaid and the $300 billion cut to SNAP. The Bronx is ground zero for food insecurity. 1/3 of my constituents are enrolled in SNAP. And the problem is not that the social safety net is overfunded. The problem is that the social safety net is underfunded. The daily budget for SNAP is $6 a day. A cup of coffee could cost more than $6. And when you factor in the impact of inflation and factor in Trump's 30% cut to SNAP, it's down to $3.15. So we're going to leave the working poor with $1 per meal every day in order to hand massive tax breaks to the likes of Elon Musk, who has a net worth of upward of $400 billion. I have constituents who, after paying all their bills, live on $20 a day. And we're going to cut health care and food for those living on $20 a day to hand massive tax cuts to billionaires and millionaires. There is something profoundly wrong with this picture. The so-called big, beautiful bill is ugliness, pretending to be beauty. It is an American nightmare, pretending to be an American dream. And it will not put America first. It will put America last. It will put New York last. And those Republicans who vote for it, let's just say there will be consequences. The SALT tax won't be the only thing with an expiration date. Thank you.
Are there any on-topic questions?
Congressman Meeks, can you talk about what this bill would mean for your district specifically and then for New York as a whole, the top priorities?
Yeah, well, for my district, number one, I have 3 hospitals: St. John's, Peninsula, and Queens Center. I talked to all 3 of those CEOs. They said this bill could force them to close. Joseph Adabo Health Care Center, they say it would force them to close. So health care would be in jeopardy in a very big way. In fact, as I talk to them, they say this is diabolical because for the first time when Obama was president, we created the Affordable Health Care Act, also known as Obamacare, where people were receiving health care. And what this bill does is takes all of that away. Secondly, I have a number of children and elderly who depend upon SNAP for food. And as indicated by my colleague, this would take that away from them. Some moving and having to rely upon $1 a day for food. So it would be devastating to a community like mine, and from Buffalo to Brooklyn and every county in between, it does the same.
Any other questions?
This is for anyone from the delegation. Can you speak to the New Yorkers who work jobs where they rely on tips and they hear in this bill that there will be no tax on those tips? What's your message to them?
Well, first of all, the tax on tips ends at $64,000. And I'm sorry, at $25,000, which means nobody's going to get which means nobody's going to benefit from this at all, because people make more than $25,000. People working in tip jobs generally make more than $25,000. So this is an illusory promise, like everything else in this bill.
That goes away, as indicated by all of my colleagues here. It's temporary. The only thing that's permanent is the tax cuts for the super wealthy. But it's $25,000. So if you earn less, you know, most people when they work, they're getting $25,000, so therefore you're not eligible for any breaks.
It just sounds good.
Can I add something?
Yes,
Like most
please.
of this bill.
Yeah, just for a second. Keep in mind that what's in this bill today, if it is defeated, does not necessarily disappear if the Republicans are willing to have dialogue with the Democrats. And in a new bill, tax on tips could be made permanent. And there are some other provisions. The overtime thing, it doesn't mean that every single thing in this bill is wrong and would not be part of a bipartisan agreement that could be come to by leadership under Hakeem Jeffries. So it's not an either or. You don't get the benefit on tax on tips if you defeat the bill. It means you go back to the drawing board and you put back a different package of things, which could include that and some of the other positive things in this. But you don't have to accept the negative things, the cuts to SNAP and Medicaid and the environmental cuts and all these other things, unless you reject this on the table and then look at a new bill that would follow.
Well, what we're saying is that the tax on break on tips in this bill is illusory because people make more than $25,000. If we negotiated a bipartisan bill, we could make that figure much higher, and we could make a real tax abatement or tax exemption for tips.
Thank you.
Thank you.